Judy Maggio here. No one is impacted more by the pandemic than the folks in the medical community on the front line helping people. And we've asked Dr. David Flieger, who is the president of the Texas Medical Association, to join us now and give us a big picture of what's happening across the state. Thanks for being with us, Dr. Flieger.
Well, thank you for having me, Judy.
So let's first talk about preparation. I know there's a COVID-19 task force that's representative of your 53,000 members. What kinds of things have the task force members been doing?
Well, we started with some of the simple questions that doctors had from the very beginning when 2 weeks ago, we're dealing about, well, how do I test? Where do I test? How do I get what's needed? We started talking about what level of personal protective equipment is needed in different scenarios. And we put out essentially white papers or announcements to the membership on almost a daily basis on those kind of issues to try to help them to prepare and know what they were looking at. One of the problems we have is there are just multiple sources of information. Many are good, many aren't, and we try to consolidate. And the task force is filled up of experts of infectious disease, epidemiology, public health. They can look through these and make sure our members are getting the right information.
And I know it's probably changing on a regular basis too.
Exactly. We literally have to put a date on everything so they know when the last time it was updated, because I could tell you something today and a week from now I might be wrong. So it's changing.
One of the big concerns, as we understand it among the medical community, is this lack of protective gear, the masks, the gowns, things, gloves, things you really need so that you don't contract COVID-19. What is the latest on that situation?
Well, we're still in dire need. This is something of proportions that no one could really prepare for. And so what we call personal protective equipment, or we'll call it PPE, is something that we need to protect ourselves, as you said. But much of what is needed is not something a doctor would have in their office normally. I mean, unless you were coming in contact with infectious patients on a regular basis, you wouldn't necessarily have this, nor would the hospitals have it in the degree that they're going to need it. So we're making efforts to try and collect that. A couple things have happened. The first is that the governor has reached out to industry, have them donate theirs and bringing that in. They've also got a task force that's helping to acquire PPE from around the country and around the world. I heard as of the last 3 days, they've put out $80 million worth of bids for PPE for the state of Texas. So big things happening there. In the meantime, our county medical societies, which of course are spread over the huge geography of Texas, are collecting PPE in local communities from, think about it, construction sites use the N95 masks, these high filter masks that we use, clean rooms for high-tech industry, dentistry, veterinary medicine. We're collecting it from any and everywhere we can get because we know that in sometime in the near future, we're going to have a huge demand.
So we hear so much about social distancing, and now we have a shelter in place order here. It never hurts to talk about why this is important, because those of us who are not doctors or in the medical field sometimes don't understand why this is critical to keeping COVID-19 at bay.
The importance is, you've probably heard this term, flattening the curve. It really is important because this is a disease that if we didn't do anything, could spike and sort of go through the community in a month or two. But in doing that, it would far exceed the capacity of our hospitals and, more importantly, our intensive care units and the numbers of respirators that we have. So we literally would have patients coming to the hospital with no room for us to put them anywhere, no ability for us to put them on ventilators. By flattening the curve, by isolating ourselves, by slowing the degree of infection and its spread, we are keeping underneath the capacity of the healthcare system, allowing us to take care of those patients. The good news is fewer people will die. The bad news is that means that this prolongation of the curve will occur. We're talking about spreading it from weeks to months.
Yeah, and that's impacts our lives in so many different ways. But as you said, it's so important that we do flatten the curve. I'm thinking about the rural hospitals, Dr. Flieger, because they were already facing such issues. How are your rural doctors faring in all of this? Some of those hospitals have been closing. There's some people that don't have medical facilities for hundreds of miles in rural Texas.
No doubt, no doubt. As you know, it's a major problem in the state of Texas to begin with. If you'd asked me before this came up, one of the things I'd often tell people is we've had 9 hospitals in our rural areas close in the last 5 years, and that's a trend that seems to be accelerating. So they have problems with financial viability in and of themselves. But oftentimes, these hospitals are a major part of the infrastructure of their towns, and they're going to be taxed to the max as far as being able to deal with this. We have a lot of concerns. We're going to need to have special attention and help them to supply them with personnel. And I see really a lot of people being transported from these small towns into our bigger urban areas with their larger hospitals.
As it stands right now, do you feel like we have the capacity to handle the COVID-19 cases that will be obviously building in the next month or so?
Well, of course, that's a question that I don't know if anyone can answer. There's
Yeah.
a lot of different modelings that go on. I think if we don't flatten the curve, then we are really in trouble. We will, by everyone's estimate, exceed our capacity. So we flatten the curve. Hopefully, we'll be able to stay in an area that we can continue to provide ventilatory support to patients, continue to provide hospital beds to patients. I think we can do it. As Texans are proud and they're tough. I think we can do it, but it's going to be a battle.
Indeed, it is. Final question, Dr. Flieger. What do you think are some of the big misconceptions among people about this virus that you would like to perhaps clear up as a medical doctor?
Well, I think probably the first thing I'd say is this is real. Okay. This is not something created by anyone with a political agenda or by Facebook or other social media. This is war. And we need to have a mentality to approach war. So, in this war, 80% of the people who get this disease won't ever have to set foot in the hospital, but 20% will. And that 20% are at high risk for severe illness and even death. So the 80% are trying to protect the 20%. The 80% are making it so if we do this right, your children can play with their grandparents. If we do this right, your friend who has breast cancer and is in chemotherapy will still be here and have a family in the months to come. If we do this right, Bob, who has the bad heart and can continue to tell his corny jokes around the water cooler, and those people will still be with us. But if we don't do this right, then basically those people will be gone. They will leave society. And what can the people of Texas do to help them? They can wash their hands, they can cover their cough, they can clean and sanitize, they can stay home. And that doesn't sound like much to do as far as the battle's concerned, but I have friends that are nurses and doctors, and they're willing to help those people in the hospitals, and some of them will lose their lives by doing that. So it's important that everyone pitch in and help, and that would be my message.
And it's an important message, Dr. Flieger. And thank you for joining us. Thank you for all of you on the front lines battling this, as you say, war for the rest of us. There's a lot of gratitude.
Well, we're going to get this done, Judy.
All right, David Flieger, the president of the Texas Medical Association. Thank you again for your time today.
Thank you.
For the latest local developments on COVID-19, go to decibelatx.org.